The concept of triage is simply a method of quickly identifying victims who have immediately life-threatening injuries and who have the best chance of surviving, so that when additional rescuers arrive on scene, they are directed first to those patients. The START triage system relies on making a rapid assessment of every patient and marking them with one of 4 colored acuity categories. Each assessment should take no longer than 30 seconds. Remembering the formula called RPM will guide you through the START triage assessment process. Respirations. If the patient is not breathing and does not begin breathing once the airway has been opened, mark the patient as deceased or black and move to the next patient. Triage team members should not begin CPR on the patient who is not breathing and does not begin breathing once their airway is opened. CPR will delay the evaluation and care of the remaining patients on scene. If the patient begins to breathe after opening the airway or is breathing at a rate greater than 30 times per minute, mark the patient as immediate or red and move to the next patient. Perfusion. If the patient is breathing effectively at a rate less than 30 times per minute, the triage team member should next evaluate the perfusion status of the patient. Gross bleeding that can be quickly controlled with direct pressure should be immediately addressed. A bystander can assist in maintaining pressure until more first responders are available in the triage area to properly address the injury. The presence of a radial pulse is the most accurate rapid perfusion evaluation tool. While some publications advocate the assessment of the patient's capillary refill, this is not as accurate as a peripheral pulse check. Patients without a radial pulse should be marked immediate or red, then move on to the next patient. If the patient has a radial pulse, the triage team member should next evaluate the patient's mental status. Mental status. Once the triage team member has determined that the patient is breathing and perfusing, they can turn their attention to the patient's mental status. Many times, the patient with an altered mental status will be evident at the start of the assessment. Patients who are confused and cannot answer simple questions should be tagged immediate or red without any further evaluation. If the patient is breathing effectively, has a strong radial pulse, and answers all questions appropriately, but was not able to walk out of the immediate area with the walking wounded, tag the patient delayed or yellow. This patient most likely has an injury that is not life-threatening, but will prevent them from moving.